Hi, my name is Dr. Ravi Sinanan. Now we're going to talk about cataracts. So tell us, what are cataracts?
So cataracts is the clouding of the natural lens of the eye. As we get older, as we age, this lens becomes cloudy. And this represents a window to the back of the eye, to the retina, which essentially is the film partly responsible for vision. If this window gets cloudy, we ultimately have to remove it. There's no other way to do this other than cataract surgery. No eye drops can help this, and there's no way to reverse the process. It is a natural aging process. There are different types of cataract. For example, as you can see here, the center is clear and there's a whitening around. This is something called cortical cataract. And this one, the front part of the lens is clear, while the back is cloudy. This is called a posterior capsular opacity, or posterior subcapsular cataract. Also, with the normal aging process, you get something called nuclear sclerosis, where the entire nucleus, which is the center part of the cataract, becomes cloudy. As we age, there can also be a combination of all of these.
Okay, so you mentioned age as a cause of cataracts. What else is there that can lead to cataracts?
So age is the #1 cause, but apart from the aging process, normal aging process, cataracts can develop by certain medications that we use, such as steroids. Whether systemic or use of eye drops, this causes cataracts, specifically this type, the posterior type, which is the posterior subcapsular type. These particularly cause a lot of problems with glare and central vision. Other types of cataracts can be induced by trauma, which is a lash to the eye, or some of them can actually be congenital. You're born with them.
Okay, let's talk to us about diabetes and its role in cataract formation.
There is an association with diabetes and cataract formation, especially if the blood sugar control is quite poor. Whether it's type 1 or type 2 diabetics, both are more prone, but again, it is based on your sugar control. The tighter the control, the less risk you are of developing the cataracts, but the reasoning is because of deposition of sorbitol into the lens, which causes the lens itself to become cloudy. Okay. It happens actually quicker in poorly controlled diabetics.
Okay, so you mentioned surgery as how it is with treat cataracts. So what would a potential patient expect when they come on the day of surgery?
On the day of surgery, they will be asked to arrive in the morning, where they will be dilated. And dilation means allowing easier access for surgical removal of the cataract. So essentially what we do is we apply drops to the front of the eye. This is to dilate the iris to allow the pupil here to get wider. This allows easier surgical access, so we can surgically remove the cataract from behind the iris. After this, once the eyes are fully well dilated, then we proceed by taking the patient into the surgical or the operating theater.
Okay. How would you know the type of lens to use during cataract surgery? I think each person is different, so how do you determine that?
So before we even bring the patient to the operating theater, we do specific measurements to determine what lens strength that we need to implant into the eye. Remember, cataract surgery involves removing the cataractous lens and placing a new clear lens into the eye, a clear lens like this, into the eye. So each person actually has a different length of eye, and therefore a different lens will be required to replace the cataractus lens. This measurement that we do a week or two before the surgical date allows us to determine what strength lens we need to implant, and therefore this lens can be specifically ordered for the patient.
Okay. Now, after the surgery, what would a person expect? Would you have a bandage over the eye drops? Just walk us through that.
So once the surgical procedure is finished, on the operating table, the eye will be bandaged, padded, and we will advise you to not remove the pad until we see you the following day. The pain usually is very minor, probably some irritation on the night of the surgery, and usually paracetamol suffices. On the following day, when you remove the bandage, you may be seeing a little blood for a day or two, and this usually resolves once the eye drops have started.
Okay. And in terms of follow-up visits, what would a person be expected to do in terms of the follow-ups?
So apart from the first day visit, meaning the day after the surgery, we will review the patient 1 week after, and then after this, 1 month. Usually after the 1 month period, anything that is of note or of importance that may occur within that period can be surgically repaired, and at this point, once the eyes are stable, unlikely for any other complications to occur so long after cataract surgery.
Okay. Now, I've also heard of people saying that the cataract comes back even after cataract surgery. Could you just shed some light on that?
All right. So the cataract itself, once the cataract is out, there is no way for a cataract to recur. When people complain of the vision decreasing after surgery and they hear about the cataract recurring, most times what they are speaking about is the bag that holds the lens in place becoming cloudy. So the cataract or the lens is actually present in the eye, surrounded by a very thin skin or something called a capsule. It is something that we all born with. During the cataract procedure, we make an opening, a circular opening at the front of the cataract or the capsule, and we remove the lens and we place a clean, clear lens into this bag, as we call it. Sometimes the back part of the bag that remains behind here gets cloudy, and that is something called a posterior capsular opacity. It actually resembles the cataract that was mentioned before. The posterior subcapsular opacity, it somewhat resembles that because it presents at the back of the lens. This is not a cataract. Some people call it a secondary cataract, and there's a polishing procedure or laser procedure that can be done. It is not surgical of any nature. There's no cutting involved, and it is short and painless, and it usually resolves the visual complaints.
Now, in some cases, a person may go to an eye specialist. The eye specialist will diagnose cataracts. Of course, everyone is entitled to have a second opinion. And let's say they go by someone else, and that person says, no, you don't have cataracts. How do you resolve those two opinions? One saying, yes, there's cataracts, and the other saying, no, you don't have cataracts. Now, can you tell us what may be going on here?
All right. So it depends on a couple of factors. Firstly, depends on where the patient went in the first instance. If they may have went to check for glasses and they may not have been dilated, they may have had early cortical cataracts. Okay. Cortical cataracts resemble this. The center of the lens may be clear, okay, and the peripheral part of the lens is cloudy. You may not notice this type of cataract if the patient is undilated. Okay. But this patient, even undilated and told that they may not have cataracts, or the cataracts may be early, may have numerous complaints. Major complaint for this type of cataract is glare. Okay. According to certain international guidelines, as cataracts develop, patients may have different complaints, and everyone is different. So two persons with the same type of cataract, one may complain more than the other. So in terms of surgical intervention, it is more patient-based. In other words, if the patients suggest to us that they are complaining of things that they did not have problems with before, and we examine the eye and we find that it is cataract, and we can attribute it to the cataract alone and no other pathology or nothing else wrong with the eye, then we will suggest surgery. Okay. Otherwise, the other option is just to observe it, wait and see, but it's all up to the patient.
Okay. Okay, so thanks a lot for shedding some light on this topic.